Let's discuss face reading, irregular menstruation. A common condition in gynecology, irregular menstruation refers to pathological changes in the menstrual cycle with the volume of bleeding, color, and quality changing in the menstrual discharge. It is manifested as an abnormal menstrual cycle or volume of bleeding, which are often accompanied by abdominal pain and systemic symptoms before and during menstruation. Irregular menstruation is clinically characterized as irregular menstrual cycle, too much or too little menstrual blood, abdominal pain, lower back pain, and even general body aches during the menstrual period. Factors such as cold attacks, irregular diet, and bad mood can all cause irregular menstruation. Weak kidney qi, stagnation of qi and blood, and deficiency of both qi and blood can also result in irregular menstruation. Face reading, the endocrine zone of women's ear shows dots or small dark red patches, and the kidney zone shows dots or small light red patches. Women with irregular menstruation often have a dull yellow complexion. So here is an illustration of the kidney zone of the ear showing dots or small light red patches and a dull yellow complexion. Therapeutic methods, if not treated in time, irregular menstruation can easily lead to other gynecological diseases. So much attention should be paid to this issue. Abdominal pain may occur during irregular menstruation. Dietary advice, people with insufficient qi and blood can eat foods such as red dates and walnuts that have the properties of toning qi and blood. Those with stagnation of qi and blood stasis can eat foods such as house and kelp that promote blood circulation and resolve blood stasis. Exercise during the non-menstrual period. Do aerobic exercise that suits you, such as walking or jogging. This exercise will enhance your physical fitness and regulate the endocrine. Emotional adjustment. Be relaxed both physically and mentally. Be happy and avoid stress and mood swings. Maintain a peaceful state of mind. Increase nutrition intake appropriately and make sure you keep localized areas warm and clean during menstruation. Black bean soup. Medicinal diet therapy is a black bean soup. Wash 50 grams of black beans, add water to the pot, then add the black beans. Bring it to boil on high temperature, then simmer for about 10 minutes on low heat. Do not add too much water. When the bean soup is done, the darker the color, the better. It is good for regular menstruation caused by kidney deficiency. Moxibustion. Apply moxibustion to the Hongqi point to regular menstruation and relieve pain. Apply to the Guanwan point to nourish the kidney and replenish essence to the Chai Hai point to enhance yang and replenish qi, and to the San Yin Yao point to promote qi and blood transformation. Gentle moxibustion should be applied to these acupoints for 15 to 20 minutes per acupoint, once daily. This can relieve symptoms of irregular menstruation. Make sure that the moxibustion is applied directly over the skin and blood. Thank you for your attention.
Okay. Let's continue our discussion on interviewing. Now about prostate and genitals. The prostate. The prostate is not directly visible and was therefore not traditionally inquired about during diagnostic questioning. Nevertheless, many older male patients might report that they have an enlarged prostate, or it may even be the reason that they seek treatment. An enlarged prostate can become stiff and rigid. In Chinese medicine, this would indicate some form of stagnation. Example, qi stagnation, blood stagnation, dampness, or phlegm. The muscles of the urinary bladder have to compensate for the prostate's narrowing of the urethra. From a Chinese medicine perspective, this means that it will require more kidney yang qi to expel the urine from the urinary bladder. This, though, is a time in a man's life when his kidney yang qi is in decline. From the age of 40 onwards, many men experience various disorders resulting from the growth in size of the prostate. The prostate grows because there is an increasing stagnation of blood and phlegm in the area. Typical symptoms of this increased growth are nocturnal urination or nocturia, frequent and urgent, but at the same time scanty or incomplete. Urination, dribbling after urination, cloudy urine, weak urinary flow, and possibly blood in the urine. The fact that various symptoms associated with the Western medicine diagnosis of an enlarged prostate start to appear when a man is middle aged or older harmonizes with the Chinese medicine concept of a progressive weakening of the kidney yang and a concurrent increase in the stagnation of phlegm, dampness, blood, and qi, the older a man becomes. The genitals. A man may report symptoms that relate directly to his genitalia. The genital pain can result from liver qi stagnation, damp, heat, or blood stagnation. The liver channel traverses the genitals, so a stagnation of liver qi can result in soreness or pain in the genitals and inguinal area. Blood stagnation in the area will often arise from physical traumas or surgical operations in the area, but can also be due to a stagnation of qi. Blood stagnation is more likely to manifest as a sharp, localized pain rather than tenderness, tension, or soreness in a larger area. Damp heat can seep down to the genitals and block the movement of qi and blood in the area. Damp heat is more likely to manifest with a burning pain or tenderness in the area. Damp heat seeping down to the lower jaw can also manifest with sweaty or sticky genitals. Cold genitalia can be seen when there is excess cold or yang deficiency. So here we see the observation and its significance. If there's lack of libido, it may be due to kidney yang deficiency, heart qi deficiency, heart yang deficiency, or liver qi stagnation. If there's excessive sex drive, maybe heat. If there's a lack of orgasms, then it's a liver qi stagnation or yang deficiency. If it is impotence, it is a kidney deficiency condition, a heart deficiency condition, liver qi stagnation, qi and blood deficiency. If there's uncontrolled ejaculation, there is kidney deficiency conditions, heat conditions, or heart imbalances. If there's poor sperm quality, then it could be kidney deficient conditions, damp heat, or blood stagnation. If it is prostate problems, it may be kidney deficiency conditions, phlegm, blood stagnations, maybe liver qi stagnation, damp heat, or damp cold. If there's tenderness or pain in the genitalia or inguinal area, this may mean liver qi stagnation, blood stagnation, or damp heat. If there is cold or moist genitals, this may be an excess or deficient cold condition. If it is sweaty and sticky genitals, then this would mean damp heat. Thank you for your attention.
Let's now discuss the acupuncture point Shou-San-Li, or the arm 3 miles of the hand-yang meaning large intestine meridian. Shou-San-Li, or LI10, is located 2 chun distal to LI11 on the line connecting LI11 and LI5. LI10, or the arm 3 miles of the yang ming, or the shining yang, which are the large intestine and the stomach channel, is naturally rich in blood and qi, and when in balance, is strengthening and nourishing. When functioning healthily, there is a natural luster to the skin and to mental processing. Yang Ming can become clogged, sluggish, and exhausted through focusing too exclusively on one area, over-refining and becoming pedantic and fatigued. Excessive study and obsessions overload the mind and prevent rhythmic processing of ideas and wastes. Stimulating this point is said to move sluggish qi, particularly when Qi has stagnated in the intestines, causing constipation with distension and pain, and thereby helping to regulate the stomach and intestines, relieving the body as well as the mind. Arm 3 miles tonifies qi and blood and is regarded by some to be stomach 36 of the arm because of its Yangming properties and very similar names of both points. This point is forbidden in the last 2 months of pregnancy. This is probably related to this point's ability to soften and move masses. Invigorating or dispersing the stomach can disperse phlegm, as most masses are forms of phlegm. This point regulates the channel problems of the LI, especially useful for any muscular problems affecting the forearm, as after windstroke or atrophy. Moxa here is said to help toothache affecting the upper jaw. This point tonifies and strengthens the body, mind, and spirit of the large intestine. It is also indicated for abdominal distension and pain, for toothache, for muscular problems affecting the forearm. This point is the intellectual exhaustion point. Consider this point if the patient is mentally or intellectually exhausted. It stimulates sluggish qi in the meridian and is effective for arm, shoulder, or facial paralysis as a result of a stroke. Thank you for your attention.
Let's discuss heart pattern, heart qi deficiency. The heart qi deficiency pattern results from weakness of the heart qi in pushing blood flow that is circulating blood. Clinical manifestation, there is palpitation, shortness of breath, and chest distress, lassitude, symptoms worsening with physical exertion, pale complexion, spontaneous sweating, and pale tongue body with white tongue coating, weak pulse or rapid weak pulse, knotted or intermittent pulse. Analysis, the pattern is mainly caused by prolonged weakness of the body or qi deficiency of the 5 Sang organs. Key symptoms is palpitation, chest distress, shortness of breath, and symptoms of qi deficiency. So here is the analysis of heart qi deficiency. Deficiency of heart qi, there is a deficiency of heart qi, powerless of pulse, so results to palpitation. Weakened Wei qi due to deficiency of qi, there is spontaneous sweating, weak movement of thoracic qi, there is chest distress and shortness of breath, weakness in circulating blood and insufficient qi and blood, pale complexion and pale tongue, deficiency of heart qi, weakness in pulsation, there's weak pulse or rapid weak pulse, then channel and qi failing to connect, knotted and intermittent pulse. So there is exhaustion or of qi after activity and symptoms worsen with physical exertion. Heart qi deficiency etiology, sadness and grief, chronic illness, blood loss, insufficient ancestral qi. Underlying or accompanying pathology, spleen qi deficiency, heart and or liver blood deficiency, kidney qi, yang deficiency, wind cold, settling in the heart, static blood obstructing the vessels. Possible presenting conditions, cardiac failure, angina pectoris, arrhythmia, general asthenia, neurosis. Signs and symptoms, there is palpitation, shortness of breath, worse on exertion, oppression in the chest, sweating, pallor, tiredness, fatigue. The pulse is empty and the tongue is normal or pale color, may have midline cracks reaching to the tip. Treatment principle is to boost the heart qi and calm the shen. For the acupuncture treatment, we use heart 5 to supplement the heart qi, bladder 15, the back shoe point of the heart, ren 6 supplements original qi, heart 7 quits the heart and spirit, PC 6 supplements the heart qi, calms the shen, REN 17 gathering point for Qi. REN 14 clears the heart, stabilizes the spirit. Stomach 36 regulates Qi. Needle with supplementation and moxa. Relevant advice: heart Qi is best tonified on the emotional level. It is important that the person cultivates joy in their life. Of course, this is easier said than done. As well as working with their emotions, the person can try to spend some time each day doing something that gives them genuine pleasure, or they can sit and meditate on something that for them is beautiful. Tonifying Qi in general will also benefit the patient. This can be done through the diet, access to fresh air and breathing exercises, as well as getting enough rest and avoiding overexertion. Our Qi can be depleted through excessive sweating. This means that the use of sauna and steam bath is not something that is recommended for these patients. The patient should avoid the use of recreational drugs, medicines, or activities that spread heart Qi. Thank you for your attention.
Let us now go to pulse taking. The topic is hollow pulse or scallion stalk pulse. A hollow pulse is superficial and is easily palpated with a light touch. It is large but feeble so that it feels empty even with gentle pressure. However, the vessel does have a measure of hardness, as though palpating the stalk of a scallion. The clinical significance is a hollow pulse indicates either massive blood loss or severe damage to yin. The massive blood loss may be due to hematemesis, melena, or hematochezia, metrorrhagia, hematuria, or trauma. Severe damage to yin may be due to vomiting and diarrhea, profuse sweating, or high fever. In addition, a hollow pulse can occur in kidney insufficiency with spermaturia. The hollow pulse is principally due to deficiency of yin, blood and essence in the interior, so that yang qi loses its anchor and floats to the exterior. Because of deficiency of qi, blood and essence, the vessels cannot reach fullness, thus producing the feel of hollowness. Because of the floating of yang qi to the exterior, the pulse is superficial in location. Blood loss, which prevents blood from nourishing the heart, causing irritability and palpitations, produces a hollow pulse felt at the tune position. Severe vomiting of stomach blood produces a hollow pulse felt at the guan position. The hollow pulse always appears after a severe loss of blood, while the leather pulse appears after loss of blood in Jing with deficient cold diseases. The clinical significance is external excess with internal deficiency is usually caused by heavy pathological bleeding. Perverse fire which penetrates the three yang causes heavy spitting of blood, vomiting of blood, or nosebleeds. In summary, the hollow pulse has the characteristics of being superficial, large but feeble. The analysis is deficiency of yin, blood and essence, so that yang qi floats to the surface and vessels are not full. The clinical significance is massive blood loss or severe damage to yin, also kidney insufficiency with spermaturia. Thank you so much for your attention.
Let's now proceed to the second part of liver qi stagnation in diagnosis according to Zhangpo organ pattern. A relevant advice for patients who has liver qi stagnation. When there is liver qi stagnation, it is best, when possible, to address and work with any mental emotional factors that can lead to liver qi stagnating. Stress should be avoided. Physical activity is beneficial because it circulates qi and thereby spreads liver qi. People whose liver qi stagnates often train a lot or work out. This is a form of self-medication where they consciously or subconsciously try to relieve or prevent their symptoms. The danger is, though, that some people begin to train excessively and damage their blood and yin as a consequence. A person whose liver qi stagnates should possibly be wary of playing competitive sports because the competition aspect may aggravate their condition, and when they lose or when their teammates do not do what they think they should. Dancing, aerobics, running, swimming, or cycling are good options because they can dynamically activate and circulate qi. Gentler forms of movement such as Tai Chi, Qigong, and yoga are also salutary because they help qi to flow, but this can be perceived as being too slow or boring for people when there is liver qi stagnation. The resulting frustration and impatience can aggravate their liver qi stagnation. More dynamic activities are therefore often a better idea, at least in the beginning. Dancing will be a particularly good way to physically activate liver qi because it is usually a pleasurable activity and will therefore simultaneously nourish the heart. It is very important that these activities in which the person engages do not feel like things that have to be done, thereby becoming a source of frustration and further stagnating the person's liver qi. Shouting or singing are good ways to spread liver qi, especially because singing is pleasurable and thereby also nourishes heart qi. It can be a good idea to incorporate physical activity into the daily routine, for example, by cycling or walking to work instead of driving, taking the stairs instead of the elevator, or getting off the bus a stop earlier, or walking the last part of the journey. Breathing exercises that involve slowly inhaling deeply and then quickly exhaling with force whilst making a loud noise will help to release stagnant qi. A person whose liver qi stagnates should try to avoid eating too much at one time or eating rich food, especially concentrated proteins such as meat, dairy products, nuts, and food that has a high oil content because this will create further stagnation. Aromatic spices, herbs, and food that are slightly spicy will move qi, and care must be taken if this also have a warm or hot energy because qi stagnations tend to create heat. Unfortunately, people with liver qi stagnation are often attracted to alcohol and spices such as chili, precisely because their spicy flavor spreads the stagnant qi. Unfortunately, this often results in the generation of heat. Going for a walk after eating will help circulate qi in the body. A teaspoon of vinegar or lemon juice and a teaspoon of honey in a glass of warm water will help to temporarily relieve liver qi stagnation. Liver qi stagnation can be caused by liver blood deficiency, liver yin deficiency, and stagnation conditions elsewhere in the body. In turn, this can result to liver qi stagnation heat, liver qi invading the spleen, liver qi invading the stomach, stagnation of qi in the upper jaw, heart qi stagnation, liver blood stagnation, and liver fire. To summarize, liver qi stagnation has its etiology in prolonged emotional disturbance like a state of frustration, repressed anger, or resentment over long periods. Underlying or accompanying pathology are kidney deficiency, liver blood deficiency, spleen qi deficiency, and its signs and symptoms: melancholy, depression, moodiness, hypochondrial epigastric distension, feeling of oppression of the chest, sighing, irritability, premenstrual tension, irregular periods, premenstrual breast distension, flammstone throat, jaundice, and epilepsy. The pulse is wiry and the tongue is normal or slightly red sides. The treatment principle: course liver, rectify qi, resolve depression, harmonize liver and spleen and stomach. For the acupuncture treatment, we use pericardium 6 to regulate liver qi, liver 13 to harmonize the liver and spleen, liver 3 to force liver qi, bladder 18 to disperse liver stasis, gallbladder 34 to force liver qi, liver 14 to harmonize liver and stomach, and Sancho 6 to regulate the liver and ease the hypochondrium. For mental depression, we use heart 8 and do 26. For oppression in chest, we use REN 17. For pain and distension in lower abdomen, we use liver 5 and liver 6. For plumstone throat, we use REN 17, pericardium 5, and REN 22. For breast pain, we use REN 17 and liver 14. We needle with even method, and moxa may be used. Thank you for your attention.
Let's continue our discussion on the inspection of gray coating and black coating of the tongue. Gray coating. Gray is transformed from white or is concurrent with yellow. It suggests either heat or cold dampness. A dry gray coating reflects damage of fluids by heat and is seen in an illness of exogenous heat or endogenous fire due to yin deficiency. A smooth and moist gray coating suggests accumulation of phlegm or rheum or internal blockage by colder dampness. Clinically, a gray coating is mainly seen in severe illnesses, chronic digestive disorders, or dehydration with acidosis. So if there's gray and dry coating, this means severe heat or dampness, cold, prolonged illness of digestive tract. There may be dehydration or acidosis and a cigarette smoking. The clinical significance is high fever, consuming body fluids, excessive fire due to yin deficiency, injuring interior. If it is gray and wet, then this would mean phlegm accumulation in interior or cold dampness in interior. If the tongue has black coating, a black coating is mostly seen in very serious stages of illnesses. Sometimes, however, it accompanies a mild illness or even occurs without any obvious illness, as in chronic cigarette smoking. Care must be taken to distinguish these situations. In general, a black coating indicates an illness in the interior, whether due to extreme heat or extreme cold. A dry black coating reflects depletion of fluids by fire. If the coating is patchy as well with high filaments, then internal heat is extreme and kidney water is on the verge of total exhaustion. It is a severity and danger sign. A moist and thick black coating suggests strong cold due to serious yang deficiency, so that dampness overflows upwards. Both gray and black coating indicate severe heat or cold in the interior. In general, the darker the shade, the more serious the illness. If the black coating is dry and covers only the tip of the tongue, it indicates high fire burning outward. If it covers the body of the tongue, it indicates dry constipation or stomach chi in the verge of collapse. If it covers the root of the tongue, it indicates strong heat in the lower jaw. If the black coating is black and dry or black and dry with fissuring and prominent filaments, this means it is often critical stage of strong heat or cold in the interior. Also upward, flaming of heart fire in center of tongue, dry constipation or impeding exhaustion of stomach chi in root of tongue, strong heat in the lower jaw. The clinical significance, strong fire exhaustion, body fluids impeding exhaustion of kidney yin, severe sign. If it is black and wet, then this means upward of dampness due to yang deficiency and strong cold. Thank you for your attention.
Let us now go to epigastric pain. The topic is stomach and liver heat. The clinical manifestations of stomach and liver heat is burning epigastric pain, irritability, propensity to outbursts of anger, sour regurgitation, dry mouth, thirst, and bitter taste. The tongue will be red and redder on the sides with a yellow coating. The pulse will be wiry and rapid. This condition is due to stagnant liver qi turning into fire after a long time and fire invading the stomach. The manifestations that point to liver heat are propensity to anger, bitter taste, and red sides of the tongue. This pattern is due to a long-standing emotional problem of the same type that leads to stagnation of liver qi. The treatment principle is to soothe the liver, clear heat, and harmonize the stomach. The points to be used are liver 14, stomach 21, gallbladder 34, liver 2, stomach 44, dew 24, and gallbladder 13, using the reducing or even method. The explanation for the points used is liver 14 harmonizes stomach and liver and moves liver qi. Stomach 21 clears stomach heat. Gallbladder 34 moves liver qi. This is necessary to do, as in this case, liver fire derives from long-term stagnation of liver qi. While liver 2 clears liver fire, stomach 44 clears stomach heat, and dew 24 and gallbladder 13 calm the mind. As dietary advice, the patient should avoid eating too many fried food, drinking too much alcohol, and in terms of eating conditions, getting angry and worrying while eating. It is also best to avoid eating too many sour food, which include yogurt, vinegar, cooking apples, pickles, oranges, grapefruit, and gooseberries. Thank you so much for your attention.